And you want to, okay,
Okay.
there we go.
Okay.
Thank you.
My name's Judy Campbell. I'm the president of the Lyme Association of Greater Kansas City, and thank you all for joining this evening. It is an honor and a privilege to welcome Dr. Bill Rawls, Vital Plan co-founder and medical director. For over 30 years, Dr. Rawls has dedicated his life to medicine. When a health crisis with chronic Lyme disease abruptly changed his quality of life, he came face to face with the limitations of modern medicine and began to explore the vast possibilities of alternative treatments, restoring. If everybody would like to mute. Restoring his health through holistic and herbal therapies inspired him to share his revelations on the importance of cellular wellness for defending against microbes and other root causes of illness. Today, he works to bring life and vitality to others as he helps them establish their own paths to wellness through modern herbology. Through his best-selling books, Unlocking Lyme and the Cellular Wellness Solution, Dr. Rawls demonstrates why crucial phytochemicals are key to protecting cellular health and strengthening the body's defense against illness. Dr. Rawls is also the founder of Vital Plan, a holistic health company where he developed the signature Restore 180 program, an advanced herbal protocol that has helped thousands to reclaim vibrant health. Dr. Rawls is a #1 best-selling author and a seasoned speaker and interviewee. With a compassionate approach and an incredible depth of knowledge, Dr. Rawls has a distinct ability to make scientific concepts accessible and enriching to everyone. I'd like to ask everyone to mute, and then Dr. Rawls will speak and present. And if you have questions, please put them in the chat, and I will go through them. And once he gets done with his presentation, I will begin asking him questions. So thank you, Dr. Rawls. We look forward to this.
Oh, yeah, thank you. Yeah, they gave you the long bio. Boy, that was a long one. Hello, everyone. You may or may not know me. I've been in this space for a good while. 2025 is a bit of a milestone for me. It was 40 years ago, 1985, when I graduated from medical school. And but it's another milestone is it's 20 years since 2005 that I consider the turning point in my journey with chronic Lyme disease, that I found herbal medicine, and it was a turning point that's when I started climbing out of the hole and getting well. And yeah, so it is good to be in this place, because in 2005, wasn't too sure how much longer I would be around, and I certainly wasn't going to be in great condition. So it's great pleasure that I get to present this kind of information. This lecture is an overview of everything that I've learned in 20 years. And it will not take but more than about 35 or 40 minutes. This is an abbreviated version of a longer academic version that is much more detailed in looking at the research behind the things that I'm going to tell you. So what I'll say is everything I'm going to tell you tonight is verified by scientific studies. My reference list of verifying each one of these points is well over 100 studies long that are information that I've been studying, really asking that question: what is chronic Lyme disease, and why is it happening? And why is it that people don't get well? Why is it that people become chronically ill, but the tick bite often occurred long before they became chronically ill? So, looking at my own journey, looking at the journey of hundreds or even thousands of people, asking those questions, digging deep, and understanding this thing. And I'm at a very, very high level of understanding with it. So I hope that you find this information valuable. How did I end up in this situation? I graduated from medical school. I went and practiced obstetrics and gynecology because I really didn't want to do chronic illness management because people never got well. And we just threw drugs at them. And OBGYN was delivering babies, bringing life into the world, dealing with young, healthy people. And it was acute intervention. You know, when somebody had a problem, you did a surgical procedure or whatever, and it could be life-saving. And that was pretty exciting. The downside was at that time to practice OBGYN, you were in a very small group, and I took call every second to third night, every second to third weekend from Friday morning till Monday morning. And I was one of those people, if somebody was in labor or had a problem in the hospital, I didn't sleep. You know, my partners, they could go crash and they would drag them out of bed to deliver the baby. I was awake. I was ready. I was by the patient's bedside. And that caught up with me after about 10 or 20 years, and I crashed. And everything in my body started breaking apart. Um, and I was pretty desperate. I identified with fibromyalgia because nothing else fit. Had a lot of symptoms of multiple sclerosis, but not enough to have the diagnosis. I had a heart issues. My heart was skipping beats every second to third beat, and I had continual chest pain, and I couldn't walk half a mile. My joints were destroyed. My gut was a wreck. I finally identified with Lyme disease because it's like, oh, I grew up in the woods. I got bitten by ticks all the time. There's got to be something behind my misery. And finally, found that I was carrying some of those microbes and thinking like everyone else, I can take antibiotics. I can get well. This is going to be an easy fix. And it wasn't. The antibiotics made me sicker than better. Um, and long story short, I didn't have the resources to go chase Lyme doctors and expensive therapies. And I was pretty desperate. And I decided to try herbal therapy not because I had great faith that it would work, but because I had run out of options and that was the only one left for me. And oddly enough, it worked. But not only did it work, it restored my health to an amazingly high level. And I've been taking herbs now for 20 years continually and researching why that is. So I'm going to share that information for you. So this is a lecture about a different story, a different take on chronic Lyme disease than you may have ever heard before, and why herbal medicine is a very important fit for that. Now, I don't know how much exposure that you've had to herbal medicine. I had virtually none when I started this. And I learned to appreciate herbal medicine not from the herbal traditions like traditional Chinese medicine and Ayurvedic medicine. I studied all of those things, but it was the science of what the herbs are doing in our body and how they're affecting microbes that really made me passionate about the value of herbal therapy. And herbal therapy basically gets a bad rap. Everybody thinks, well, herbs are just weak versions of drugs. What I've come to appreciate is it's apples and oranges. Herbs are nothing like drugs. And especially the herbs that I'm going to talk about tonight, completely different than drugs, have very dissimilar characteristics and should be used completely differently. So we're going to talk about that. And there we go. Let's see if then we can get that going. So, what is herbal medicine? Herbal medicine is the therapeutic use of certain plants and fungi. We have medicinal mushrooms to reduce symptoms and promote healing in the body. We're going to talk about that. Promote healing. When we talk about medical therapies, virtually every drugs cannot promote healing. And that's the difference between drugs and herbs. Drugs can block symptoms, they can slow progression of illness, but because they do not get to the root causes of the problem, they do not, especially when it comes to drugs for chronic illness, they do not promote healing. Herbal medicine very specifically promotes healing in the body, and that's really important to recognize. So, there are a lot of plants out there that we would define as herbs. So, first off, I want to talk about the fact that we're talking about a select spectrum of herbs. So, herbs, you start at one end, you're talking about food plants and culinary herbs like basil and oregano, all the way down, which do have some wonderful properties, all the way down to the opposite end are plants that have strong drug-like or even poisonous properties. So there's a pretty wide range of what we define as herbs. Now, most herbalists don't use the ones down at the end that have strong drug-like properties. And actually, that's where 50% of your drugs come from. So if something has strong drug-like properties, it's potentially a poison. All your medications are potentially poison. Even over-the-counter things like ibuprofen or Tylenol, if you take a bottle of it, a lot more than the prescribed dose, it can make you sick or even kill you. So most of our drugs are poisonous at anything beyond a therapeutic level. And that's true of some herbs, drug-like properties, but we don't go there. So an adaptogen is a class of herb. This is a term that's been used for a very long time. It was coined by studies in Russia that they were looking for substances that made humans more resilient to stress. And they started looking at drugs and they found none of them did. But then they went back to some of the classic herbs that had been used, like ginseng, and found, okay, we're talking about something good here. These plants have the ability to actually make the body more stress resilient. And we found out that how they do that is they balance stress hormones, they protect cells of the body, they balance immune system functions. And by doing that, they can raise energy. And so they have that resilient effect. So part of the definition of an adaptogen is that they don't have drug-like effects and they have a very, very low potential for side effects. So what it means is they can be taken for a long period of time. And so in Indian, in Ayurvedic medicine, it's called a Rashiana. And what that is an herb that was revered for promoting wellness, promoting longevity. And it's not something that you took, for a month to get rid of a symptom or that sort of thing. It's something that you took to enhance your health. So, an adaptogen. So, I've been using a particular class of herbs that are associated with chronic Lyme disease that have strong antimicrobial properties. And so there are a particular group of herbs that we're going to talk about this evening that have strong antimicrobial properties, but also would be considered adaptogenic. They don't have drug-like effects. They actually enhance cellular wellness at the cellular level. They balance immune system functions. They balance stress hormones. But these herbs have stronger antimicrobial properties that have been recognized and documented. So why did they do that? Well, when you look at this thing, all living organisms must have defenses against microbes, bacteria, viruses, protozoa, yeast, things that attack and damage cells of the organism. So every living organism, even bacteria, must have a defense system against other microbes. bacteria against other bacteria, bacteria against viruses, all of the everything. So we have an immune system, we have defenses. But plants also have a defense system. Now, the difference is our defense system is cellular. We have immune cells that circulate throughout the body. Whereas with a plant, they use a cellular defense system. So they are generating all kinds of chemicals that have antimicrobial properties, but it's not one chemical. It's hundreds or even thousands of chemicals that have a wide spectrum of benefit against a wide range of microbes, pathogenic bacteria, viruses, yeast, protozoa. And every plant has that, but some plants have it stronger than others. And it has to do with the plant's native environment. So plants can't get up and move around. They can't migrate across the globe. They're pretty much stuck where they are. And if there's a lot of microbe stress in that particular environment, then that particular plant is going to be pumping out a lot of chemicals. But again, when we're here, we're talking about when you take the herb, basically you're borrowing that defense system from the plant. And, this is not a new thing. Humans have been taking herbs, and we know that they took herbs for things that we now define as infections, and they've been doing that for thousands of years. That's been documented. So this isn't a new thing. It goes back well before recorded history that humans were enhancing their microbial defense system with plants. And we've been doing that for a long time up until about around 100 years ago, we started trading it for antibiotics. So how is this plant antimicrobial different from an antibiotic? Well, a lot of people think, and I used to think this, that there's some smart scientist in a lab somewhere that figures out this chemical and they create this synthetic chemical that targets specific bacteria or specific viruses. And yeah, we're not that smart. So all antibiotics, every single antibiotics originally was sourced from a natural source. So all antibiotics came from either a plant, a fungus, or a bacteria, every single one of them. Now, you've probably heard of ivermectin. Ivermectin actually came from a bacteria in a swamp by a golf course in Japan. So scientists go out and look in nature and see what they find. And, and when they find this thing with something that might have antimicrobial properties, they don't take the whole defense system because we're not that smart. We can't reproduce the defense system of another organism. They pluck a few chemicals and they test to see which might be the strongest, and they stick it out there and basically put it in a lab and say, well, let's see what this will kill. And then once they find something that has some power to kill certain microbes, they take that single chemical and they change it chemically. They modify it for two reasons. The big one is to get a patent on it, because you can't patent things that are natural. And the second is to make it more potent. And then, and you may change that chemical over and over and over again and get a whole series of different antibiotics out of it, but the original came from that one source. So that's true of every antibiotic. The last antibiotic was produced in 1985 when I graduated from medical school. We have made no new antibiotics. It cost over $2 billion to bring a drug to market. And pharmaceutical companies are focused on drugs that people use for chronic illness that they will take for a lifetime. That's where they can make their money. They don't make any money on antibiotics. They're not researching new antibiotics. And that's a real problem that we'll talk about. So when you look at herbs, it's completely different. It's a defense system, not a single chemical. So when you look at these things I call antimicrobial adaptogens, it's really a solution that perfectly fits the problem of chronic Lyme disease when you truly understand what chronic Lyme disease is. So what is it? Well, short answer is chronic Lyme disease is a self-sustaining cycle of cellular stress and microbial reactivation. I'll help you understand that better. So, when we look at the Lyme bacteria, when you talk to most people with chronic Lyme disease, they didn't get sick at the time of a tick bite. Now, that does happen, and we can talk about certain situations where it happens, but most people with chronic Lyme, over 90% of the people I've talked to, hundreds, thousands of people in the past 2 decades, they relate other stress factors. Their illness either came on suddenly with some precipitating stress, a chronic stress, an automobile accident or something, or it came on gradually as stress in their lives accumulated and they began aging, but it typically didn't start with a tick bite. And that tells you something about the microbe right there. So that is a big factor that this is something that a question that I was asking early on is because I didn't get sick until my body was stressed, which meant I had been carrying these bacteria in my system long before I actually got sick. And that's true with most people. So these bacteria don't have the same strategy as other kinds of pathogens. So the Lyme bacteria, co-infections, Bartonella, Babesia, all the rest of them, Anaplasma, and then some things that you pick up beyond ticks like Mycoplasma, Chlamydia, Epstein-Barr, they won by stealth. And they're not aggressive. And so when they enter the body, they are not trying to overwhelm you and make you sick. They are trying to establish a presence in your body. That's what these bacteria want. And I think that's one of the things that's missing in our understanding of Lyme disease is there are a lot of people that get bitten by ticks that contract this bacteria but don't get sick. Or they get sick mildly and they don't know they've been bitten by a tick because, one more time, Borrelia, Bartonella, Babesia, they win by stealth. Their strategy is establishing a presence in the body, and they don't have to make people sick to do that. That's what they want to do. So they use some really sophisticated mechanisms of doing that, but there are a couple of things that are really important. So one is they grow really slowly. And this is true of Borrelia, Bartonella, Babesia, and all the rest of them. They grow really slowly. So if someone picks up pneumonia, they get a pneumococcal pneumonia in their lungs, that bacteria is growing very, very rapidly. It is turning over. It is doubling every 20 minutes. Every 20 minutes, that thing doubles, which that means somebody can get really sick really fast. Well, that's what antibiotics work for. Fast growth is really important for antibiotics to work. So the faster something is growing, the better an antibiotic will work. So if you get a pneumococcal pneumonia with those fast-growing bacteria, the antibiotic is going to knock them down really rapidly, and somebody can get well within days to a week. So that's where antibiotics really work well. Borrelia, doubling time, pneumococcal bacteria, turns over, doubles every 20 minutes. Borrelia, 12 to 24 hours. Babesia, 12 to 24 hours. Bartonella, 12 to 24 hours. Really, really slow. And that's a defense mechanism that they're less targeted by the immune system. Again, they're not trying to overwhelm you. They just want to have a persistence. So that slow growth makes them less of a target to the immune system and less responsive to antibiotics. The other thing they do, and all of them have this capability, is they invade cells. And so when that thing enters through your system, it's coursing through your bloodstream, and it it it's trying to clear out of your blood pretty rapidly. So it has sophisticated ways of crossing the blood-brain barrier. It enters your tissues, your joints, your muscles, your heart, and it invades cells because cells give it refuge from the immune system, and also it protection from antibiotics. So once it's inside a cell, the antibiotics can't really get to it very well. But say that cell is healthy, because our cells, we all talk about our immune system as our defense. Our cells can defend themselves through a process called autophagy. Cells can digest bacteria and get rid of them. All our cells have this capability. But in this give and take of hundreds of thousands of years of humans being bitten by ticks and picking up Borrelia, what happens is the bacteria can invade the cell and then slow its growth or even go completely dormant. And this is true for all of these different bacteria. So when we look at, a lot of Lyme doctors out there are using anti-malaria drugs, really strong drugs, very toxic drugs to kill Babesia. Same problem. Malaria, the protozoa associated with malaria, is very fast growing. It has explosive growth, and it responds to those drugs. Babesia grows at a snail's pace. It's really, really slow. So even though they're both protozoa and have some things in common, Babesia is really, really slow. It doesn't respond to the drugs in the same way. Different microbes invade different cells, and this is important too. So Borrelia likes collagen-producing cells. It invades the nervous system and the cells that protect our nerves, called Schwann cells or oligodendrocytes that have myelin. It needs that substance as a food. It invades chondrocytes or cartilage cells, and so. But Bartonella, it likes the cells that line blood vessels because part of its food is red blood cells. So if it's right there in the blood vessel, it can scavenge red blood cells. Babesia, the same. So they show up in different places in the body. Now, I know everybody hears about biofilms. Biofilms is a factor, but it's typically late in disease, and it's not as big a factor as these other things. So another thing these things do, all of these bacteria invade white blood cells, and they can stay alive inside the white blood cell, and they're able to manipulate the chemical messengers, which is really interesting because what they're doing is shifting the immune system's responses from taking out cells that have been infected with microbes to being hyperallergic. So people get mast cell activation syndrome and these other things, and it's the bacteria manipulating those signals that are causing that. So really sophisticated mechanisms of not making people sick, but persisting. That's very important. But once they're there, they're there. So if you can imagine, you get bitten by a tick, and maybe a number of ticks in your lifetime, and maybe you get bitten by a cat like I did, and you get other kinds of sources of various kinds of microbes, and your tissues get peppered. Different cells throughout your body get peppered with these things, and you pick up all these different microbes, and they establish a presence, and you're not really sick. You're doing okay. But say you're under stress for years, and then you're getting older, which means your cells are getting older and the cells containing the microbes are getting older. Then you start to have some symptoms here and there. And it's because as cellular stress accumulates and these cells are weakened, eventually you reach a point that these microbes wake up, these pathogens wake up, and they reactivate basically. They've been in a dormant or quiet state, they reactivate. And when they do, they emerge from that cell, destroy that cell, and start invading other cells. And that's where you start having symptoms because all of your symptoms can be traced to cellular damage and stress. You have heart symptoms, your heart cells are damaged. You have joint symptoms, your joints are damaged. So these bacteria, basically, what they're doing at that point is they're growing. And when they're growing, they need food. And what's the food? Our cells and tissues are the food. So they start breaking down. They use enzymes and all kinds of sophisticated things to start breaking down our tissues. Everywhere that's happening, we have symptoms. Different microbes are invading different cells in the body, so we get a wide range of symptoms that are not just Borrelia alone. They're typically associated with co-infections with other things. And that is starting to look like that's what the picture of Lyme disease is. So I have a name for something called the boiling point. So when you have this thing, typically it's not like you are well and then you're suddenly sick unless you have some kind of really enormous stressful event. So this is gradually happening. And it happens to a lot of people in their mid 40s is when it shows up, or 50s, because stress has been adding up through your life, but your cells are aging, and you finally reach the point that these cells containing the microbes are able to reactivate. And when they reactivate, they start invading other cells. So cellular stress, weakened cells, is what drives this thing. So the boiling point is the point at which it becomes a self-sustaining process, that there's enough microbe reactivation to drive enough cellular stress that's fueling more microbe reactivation and more cellular stress. And that's what chronic illness is. That's what chronic Lyme disease is. But it's also what multiple sclerosis is and autoimmune illness is. And virtually every chronic illness now we're seeing this microbe factor. So if you understand chronic Lyme, you understand every single chronic illness. And that's really important. So to win this battle, you have to break the cycle. You have to not only curtail that microbe stress, you've got to restore cellular health. And if you're not doing both of those things, if you're using therapies that are toxic to your cells, there is a very low probability that you will experience the long-term wellness that I've been able to achieve. Very unlikely. So in a way, it's about making peace with the microbes, not eradicating them. I've come to the conclusion that it's impossible because this is a lot bigger than chronic Lyme disease in a lot of places for most people, because quite frankly, we're picking up things through our whole lifetime. We pick up mycoplasmas when we're kids, and chlamydias, and a very wide range of different viruses, and whatever you've been tested for, multiply it by a factor of 100, 10 to 100. That's what's actually floating around in your tissues, because we pick up a lot of things that reactivate. And not only that, things from our gums, things from our sinuses, things from our GI tract are constantly crossing over into our bloodstream, and they end up buried in our tissues too. So it's more complex than I think most people are looking at. But to solve the problem, you've got to address the cellular stress as much as you've got to address the microbe reactivation. And that's why things like antibiotics fall short. So they're single chemical agents, as I said. Because it's one chemical, not hundreds or even thousands of chemicals like you find in an herb, bacteria can get around that pretty fast. And they do a good job of that. So one of the biggest problems with antibiotics is within 10 days, 10 days, that's all it takes to generate antibiotic resistant pathogens. It only takes that amount of time. And as I said, no new antibiotics since 1985. So there are resistant pathogens floating around out there to every single antibiotic made, every single one. And we're way overusing antibiotics. So we're ramping up the number of pathogens. We're making super pathogens by exposing them over and over and over again to antibiotics that they become more and more and more resistant to, which makes them stronger and stronger pathogens. Chronic Lyme disease, people die of it, mostly from the complications of it, but it's not killing 1 million people a year. Antibiotic resistant pathogens now kill well over 1 million people every year. It's a worldwide problem, and that's been going on since the 90s. 1 million people every single year. It's an enormous problem. And every single time somebody uses antibiotics for months on end to try to solve a problem that antibiotics weren't made for, they are contributing to that problem every single time. So not only do they develop antibiotic resistant pathogens in their body that are sometimes a lot worse than the Lyme bacteria, they also contribute to this worldwide problem. Antibiotics within 10 days start to disrupt gut flora. So, and I talk to people all the time. It's like, oh yeah, 6 months of antibiotics, it did get rid of all the Lyme bacteria. I don't have Lyme disease anymore, but my gut's a wreck and my life is miserable. Some people get well with antibiotics, but it's more the exception than the rule. There are no studies that document long-term use of long-term antibiotic use as a mechanism for eradicating chronic Lyme disease. Doesn't. So disrupting gut flora is a big deal. When you suppress your normal flora, so when you look at these things, the antibiotics work for fast-growing bacteria, but they hit other things too. So they're hitting things in the gut. Even if you use IV antibiotics, you're still hitting the gut. And those aren't growing as fast as a pathogen like pneumococcus, but they're growing a lot faster than Borrelia or the Lyme bacteria. The Lyme bacteria in the tissues, they're really slow. They're inside cells. So you're hitting your gut flora pretty hard. And so that just wrecks the gut and creates a whole cycle of different problems. Besides that, antibiotics are toxic to cells and mitochondria. And that's a real problem. You can't get well with things that are toxic to your cells. This is true with cumulotoxicity with most invasive therapies. And I define most things that people are using out there as partial solutions, not complete solutions. Antibiotics are partial solutions because they kill the bacteria, but they don't affect cellular stress. In fact, they worsen it. This is true of hyperthermia. This is true of IV ozone. This is true of SOT. We can just keep going down the list of all the many, many, many Lyme therapies out there. And I would say, if all these therapies that all these therapists, these providers were offering really worked, we wouldn't have such a problem with chronic Lyme disease. But most of them only provide transient benefits because they suppress the bacteria, which helps, but it doesn't address the cellular stress factor. So within a short period of time, you're right back reactivating more bacteria because all these things do is kill the active bacteria that are outside cells. They don't get the reservoir of bacteria that are left remaining inside the body. So that's a big problem. So it's so when you look at this problem, that's when you get back to the herbs, the potential for toxicity is low. They protect cells, and that's really important. They do suppress the microbes. And the real value of antimicrobial adaptogens is because the toxicity is so low, because the cost is reasonable, you can keep going with them. And this is something that I learned early on in my recovery. When I first started, I thought, well, if these herbs actually kill the bacteria, it's going to wreck my gut too. but it didn't. My gut got better. And I've actually found a study documenting something that I observed for years is that the the herbs actually suppress pathogens in the gut, but they don't disrupt normal flora. Makes sense. It's a defense system that the plant is using, and it doesn't want to hurt friendly flora. It wants to kill pathogens. It's selective. It has intelligence. That's really important. And I found that whenever I stopped the therapy before I was like really well, then my symptoms would start creeping back. I'd get to be 70% better and I'd run out of herbs and I'd stop taking them and stress would come along and I'd be getting sick again. It took me about 5 years of herbal therapy at pretty high doses to get to eradicate all the symptoms. But by the time that I did, I yeah, I got rid of all the symptoms completely. Plus, I got my health back to a higher level than I ever thought I would. I'm now 68. The past decade, more than a decade, I've experienced some of the best health and lowest incidence of symptoms that I have had in my entire life. I'm still aging, don't have the energy that I had when I was 40, but I don't have debilitating symptoms at all. So, really important to consider these things. So, when you look at these characteristics of the antimicrobial adaptogens, these are multi-compound. So we typically in herbal medicine we combine multiple herbs because you synergize the benefits, not the side effects. And the more you combine different herbs and you get they already have broad spectrum activity, it extends that. They suppress the microbes as they reactivate. Now the herbs, they're not going to get to the dormant microbes inside cells any better than anything else. But because you can take them continuously, whenever things reactivate, when you're still in that reactivation stage, it's suppressing and killing them as soon as they reactivate. So it's really important. So long-term therapy is the solution. You have to do it for months or even years, but you have to do it with something that doesn't disrupt your gut flora, doesn't generate antibiotic resistant pathogens, and protects your cells and mitochondria. Because that's the other side of herbs. You're getting a whole cell protection system. Is protecting your cells from free radicals, toxic substances, radiation, all the different stress factors that we're exposed to. It's protecting against those things. So it's exactly what you want. So, is there any evidence? Actually, there's a load of evidence out there, but there are a set of herbs that we've been using for a couple of decades, starting back around 2005, that have really gotten a lot of attention. And there have been some really good scientific studies documenting the antimicrobial properties, but not only antimicrobial, the adaptogenic, anti-inflammatory, immune balancing properties that are so valuable. So these are just kind of some of my key herbs. I use a lot of different herbs. There's a wide range of antimicrobial adaptogens that we can choose on, but these are the ones that we really have the most evidence on. So, and it's a good range of evidence. So there was a study in 2020 that they looked at about 14 different herbs that had been used in chronic Lyme, and they found that 7 of them actually were able to kill Borrelia. And this was a test tube study because they wanted to eliminate the effect that the herbs might have on the living immune system. They wanted to know, does this thing actually kill? And they found that these herbs, 7 of the herbs, and 4 of them, my top 4, were the list that I just showed you, were able to kill Borrelia, the cis forms and the active forms, better than several of the antibiotics. But interestingly, they took the same herbs. So these were different studies done by some of the same people at different places around the country. They did the same kind of study for Babesia. And they found that these same herbs had great activity there too. And they did it with Bartonella. Same great activity. So that's the interesting things is the broad range that these herbs have. And even beyond that, these herbs were active against the SARS virus that causes COVID-19, along with a whole lot of other viruses too, and protozoa and yeast. So it's really a pretty remarkable package when you put it all together. So Japanese knotweed, one of my favorites, broad spectrum antimicrobial, calms inflammatory cytokines. How does it do that? Everybody, it's like, oh, this calms cytokines. How does it do that? It protects, it reduces the microbe stress, protects immune cells, protects cells in the body, takes the load off the immune system. And when the immune system isn't loaded down, it calms its messengers. The messengers are less intense. That's how it works. Protects mitochondria directly, reduces oxidative stress, free radical damage, neuroprotective, cardioprotective. Cryptolepis, another favorite, really good for Bartonella, Babesia, many other things, anti-inflammatory. This is an herb from Africa, but it's widely grown. And all these things are immune modulators. That's an important word. So some herbs are immune stimulants like echinacea and elderberry, great for acute viruses, but not something you would take a long time because you don't want to stimulate the immune system. You want to balance the immune system. That's the difference between an antimicrobial or an antiviral herb and an antimicrobial adaptogen. All of the antimicrobial adaptogens are immune balancing. Chinese skullcap. This is another, people have asked me, well, if you were on a desert island, you could only have one herb, what would it be? Chinese skullcap, every time. So well tolerated, great antimicrobial, super broad spectrum, wonderful anti-inflammatory, great immune modulator, adaptogenic, neuroprotective. Cat's claw, almost everybody's heard about that one. It's been used for both protecting brain functions for dementia, cognitive decline, arthritis in Amazon where it's native, but also has just wonderful broad spectrum antimicrobial, immune modulator, neuroprotective. And I generally pair these with other immune modulating adaptogens. Are some of our mushrooms like reishi and cordyceps are particularly good for that. Great cell protectants, great mitochondrial protection. Sarsaparilla is another really wonderful one for that. And you put it all together, these suppress microbes, reduce inflammation, balance immune functions, support mitochondrial functions, protect our cells, and that's what we need to get well. And you can use them long term, and that makes an enormous difference. So, but when you look at the whole problem of Lyme disease, what I've found is just throwing herbs at it isn't enough. You still have to reduce cellular stress. So part of it is, so everybody comes in that their body's in total turmoil and they've got this super fight or flight response and they're not sleeping and their whole body's agitated. So using herbal therapies and relaxation techniques and different kinds of things to calm that overactive fight or flight is really important. And that's the gateway to getting gut function back to normal, opening up detox pathways, and then finally really working hard to restore cellular health. So I created a program that's a 6-month program that's designed to take this thing and break it down into steps and stages and carry people through this whole process that's so vitally important that, this is a result of my study of this condition for many, many years. So that program is available if anybody's interested. So that's where your recovery starts. Herbs are really safe and effective, and that systematic program makes a difference. And I'll leave this up. If anybody is interested, I don't know if you've heard of our Restore 180 program, but for this month, we're running a 50% to $50 discount. You can find out a lot more about the program at vitalplan.com and slash restore 180. So this is a program that we have been working on for a year. We've graduated just a couple of groups so far, and the results have been extraordinary. I've been using herbal therapies and herbal protocols for well over a decade and a half to help people. But this is just the culmination of everything that I've learned over that 2 decades to build a systematic recovery program that incorporates everything that people have to be doing, along with all of the herbal support and everything that is necessary to overcome Lyme, and plus the community support, the health coaching. I mean, it's a pretty comprehensive package. This is a complete solution. You cannot get well without a complete solution. So I'll leave that up a minute and we can move on to questions. And I know I've taken a chunk of time here, but I am willing to hang around for questions as long as y'all want to keep asking them.
Okay, that was wonderful. Great presentation.
Thank you.
One of the questions we have is, did you watch RFK's HHS Lyme Roundtable yesterday? And if so, how do you think herbal medicine may fit in with the new HHS goals?
Yeah, I did not watch it. We were having the past 2 days, we've been having a team meeting to talk about how we can optimize this program. I don't know what RFK has to say. I do know that I'm hearing a lot of mixed messages from a lot of folks. I think there are very, very few people that understand chronic Lyme disease in the way that I have come to understand it. And again, that's from 20 years of really, really looking at the research. Um, I'm just, I'm hearing a lot of misinformation out there. Whether they've got it right, I think it'd be great if they are, um, but I'd kind of be surprised. But I definitely am going to come back and listen to that. I'm interested in what he has to say.
Okay. Um, I have neurological Lyme, transverse myelitis in spine and lesion in brain, Bartonella, Babesia, and I'm not going to pronounce this right. Myomodi strain. I can't take antibiotics due to past C. diff infection.
Yeah,
Um,
correct your gut.
can
Exactly the problem I was talking about.
can they clear and treat everything with herbals, and which herb can treat all that they have if you have to pick just one or others in conjunction?
I'd never pick just one. That's not how herbal medicine works. Most of the time you want to work with a single drug or a single antibiotic because all drugs have pretty significant toxicity, and antibiotics have some of the highest toxicity, cellular toxicity and disruptive characteristics. So when you combine antibiotics or combine any drugs, you compound the toxicity of those things. With herbs, you compound the benefits because we're talking about a natural system that humans have been exposed to for literally hundreds of thousands of years. So we tolerate it better. So, not to say that all people tolerate all herbs, but most people tolerate most herbs quite well. And doing combinations of herbs gives you a much broader spectrum of benefit because, again, I'll say once more, whatever you think you have, whatever you think you've been tested for, multiply that by a factor of somewhere between 10 and 100, and that's what's actually in your system. Because, quite frankly, our ability to test for microbes is poor, poor. And another thing to think about it is all of our testing is designed for picking up acute infections. Someone who gets bitten by a tick and they have a very symptomatic infection, which probably doesn't actually happen all that often. Most of the people being tested identify with chronic Lyme disease. or post-treatment Lyme disease syndrome. And so here you're talking about something that's persistent in the body, is within a reservoir inside cells, and it's not just one microbe, it's a spectrum of different stealth pathogens. So if things aren't active when you do the test, then it's not going to be positive. And so testing often is fair at best. And you've always got to account for things that are beyond what the tests show. I mean, think about it. 40 years ago, we didn't really have a test for Borrelia, or it wasn't very reliable, and nobody had heard anything about co-infections. It's only been in the past decade that we've really refined the test for Borrelia and started looking at co-infections. But ticks carry literally hundreds of different bacteria, and we don't know most of what most of them do or their potential for illness. So that's a value of the herbs. You get broad spectrum coverage. And typically, if someone is not responding to a set of herbs, it's pretty easy to add other herbs, and gradually you will get things under control.
Okay. I recently tried golden seal and it seemed to make me much worse. What are your thoughts on it?
Yeah, golden seal, well, it depends on how you define worse. Um, so golden seal is a really nice herb. We're not using it as much as we used to because it's not grown, it's not cultivated, it doesn't cultivate well, and wild sources are under a lot of pressure. So there are other herbs where you can get the substance that we're looking for, which is berberine. So there's coptis and quite a few other different herbs that are sources of berberine. Berberine is a really nice ingredient. It has some wonderful properties. It kills a lot of bad bacteria in the gut. It's not absorbed systemically very well, so I don't really consider it a primary Lyme herb very much because you're not getting a lot of it systemically. And sometimes people don't tolerate berberine very well. So again, it's one that we use pretty much in low quantities or in gut restoration, not as much as a primary Lyme herb.
Okay. All right. Are there any good herbs for alpha gal?
Um, yes and no. So when you look at alpha gal is an allergic reaction, not necessarily to bacteria, but to an antigen that comes from beef that gets mixed in the tick's saliva. So the tick bites you and injects this antigen into your system, and you develop an immune reaction to that antigen, and therefore, and when you eat beef or any any tissue from from a mammal, you have an immune reaction. Now, I personally think that the manipulation of your immune system by the pathogens is probably playing a role in that, but it hasn't been well documented. So, in one way, I would say that herbal therapy is going to help balance the immune reaction. It's going to help control the microbe stress that's going on in your system. So, in some ways, it really, really helps the situation quite a lot. But it's not, once you activate that immune response, it takes a lot to get it under control. So the herbs are a good adjuvant. They're a good thing to take as a complement that can help get things back under control. Something I've learned about recently is a form of acupuncture called the Solomon auricular uh, anti-allergy therapy, I think. I may not have that completely right, but it's the Solomon auricular. And they basically put an acupuncture needle in places in the ear And I have a friend that's an acupuncturist, and they say they're getting pretty good response of calming these overactive or aberrant immune reactions. So a combination of just, taking the herbs and following a protocol, a health protocol of cellular restoration can really help a lot, but doing some of these other things can help calm that reaction. And just reducing the exposure to the antigen is a big thing, which can be a kind of a pain because that antigen shows up in a lot of different foods, even things that you wouldn't think would be meat related, but yeah, there are some things that you can do to calm it down.
Okay. When trying cat's claw, blood work indicated neutropenia. Is this a common problem?
Well, it's a common problem with the microbes, for sure. I mean, the microbes are suppressing the immune system. And sometimes we get odd reactions, and it is hard to you have to kind of see through the testing of what the testing is telling you. So you have two factors. One, that we know the microbes are directly affecting chemical messengers called cytokines that are affecting the immune system. And again, they're suppressing neutrophils because those are the cells that take out cells that have been infected with microbes and microbes, and they're activating, they're blowing up that mast cell activation. They're basically shifting the immune system. So the microbes are driving that. The pathogens are driving that. But another thing that can happen though is when you're taking herbs, especially early on, the herbs are actually killing and clearing. They're accentuating the ability of the immune system to kill cells that have been infected, and that can include neutrophils that have been compromised. So, for a short term, you could see even more of that effect, but typically over the long term, it does get better.
Okay. Next question. I take several herbal mixes, but some herbs I need to avoid, like cat's claw, sarsaparilla, Japanese knotweed. Does your program have something that helps to tolerate those kind of herbs?
We can work around a lot of things. We use standard protocols, and not absolutely everybody can take the protocol. But um, what we focused on in using in our protocols is the herbs that have the very, very best evidence, and those are some of the herbs that have the very, very best evidence. But there are a lot of great herbs out there, and there's certainly alternatives that you can use. So if somebody tomorrow said, "Hey, those herbs in your protocol that you've been using and get great results with, you can't get those anymore. They're just not available." I would say, "Okay, that's fine. I've got another set over here that I can work with." Um, and so there are a lot of good herbs out there and that also work just as well. Um, so what we are trying to do is sell the convenience of a standardized protocol. Not to say that it's a one size fits all. It's not. This is a program that is to build a foundation. And we've had plenty of people, virtually everyone that's been through the program so far has said, "Hey, I, I would go through this program just for the education because I learned so much." We want to make people experts in their own recovery, and there's nobody out there that's really saying that. Because I think that's the key to getting well is being an expert in your own recovery. If you're not doing that, it's unlikely that you're going to have the kind of success that you really need. Um, so yes, we're using standardized protocols because it is very hard to do mismatch protocols. But we can certainly guide people in that, and we certainly people get a lot of education And we have a lot of different alternatives within the protocol to meet those different demands.
Okay. I have mold toxicity illness 2, positive HLA-DR susceptible gene, was living in mold and makes me very ill. Can I take, is it reishi mushrooms while working on getting rid of mold since mushrooms are like mold?
Um, Mushrooms are a fungus, mold is a fungus. But, you know, that's kind of like saying, um, you know, I can eat apples, but I can't eat oranges. I mean, they're different fruits. When you look at mushrooms, the mushroom world is extraordinarily diverse, and it contains mushrooms that can kill people. It contains black mold that's under, but it contains very beneficial mushrooms also. So mold allergies do not mean allergies to all fungi by any means. And yeah, so most people do just fine with it. And mushroom mold allergies are often hard to define, and they're very, they're specific to specific different spores. So when you look at mold is a problem. Here we're talking about mold that like grows in your bathroom or contaminates wheat or, that grows in warm, moist places. And it's really not the same thing of the different mushrooms that are growing out in a forest. Um, but what's happening is those molds propagate by producing spores. They produce spores that land in other moist places and they start to grow. All molds need moisture to work. So they're propagating by molds and they're putting those things out in the air. So if you've got a lot of mold and it's pumping out spores and you breathe those things in and your immune system is already messed up, then it exacerbates a bad problem. But the other thing is mycotoxins, and that's the bigger problem. So mold's arch enemy are bacteria. And all molds, the molds that are growing in warm, moist places produce mycotoxins to kill invasive bacteria. And those mycotoxins work by binding to the bacterial cell, which is very, very small and primitive, and destroying the cell. But they also bind to any other living cell. So they're circulating around through the air, and we breathe them in, and they damage our cells. So that's the big problem with mycotoxins is we're breathing them in or that we're getting them in our food, they get in our bloodstream, they damage our cells. And then on top of that, you can become sensitive to the spores. The solution for mold is get it out of your environment as much as you can and reduce your exposure. That's how to treat mold is get it out of your environment. Um, but that being said, in my recovery, at the worst point in my life, I had to stop practicing obstetrics and I had to have some way to generate revenue because I had a mortgage and two kids in college. And I started a general primary care practice just to pay the bills. And there were no offices available. It was a small town. And I bought an old 50-year-old building because it was the only place where I could practice. It was full of mold. The whole basement, the whole crawl space was covered in mold. And I worked in that building for over a decade. And I recovered and got well in that building.
Mm.
And I didn't have the money to do a complete mold remediation. I ran ozone generators on the weekends. I ran filters in every air filters in every single room. I ran diffusers with essential oils because they push the mycotoxins out and start breaking down some of the mold. And I did that continually. And I did herbal therapy and I changed my lifestyle and I ate better and I got every other toxin out of my life. and I recovered and got my health back in that building. So the point of that is sometimes we get caught in situations that, you can't get away from because I tell people all the time, if you got a mold problem, the solution is you got to get out of that house or office or, apartment or whatever you're in. You got to get out of it. But sometimes I recognize that's hard. So you do everything else in your life. You clean up your diet, you clean up your exposure to all other toxic substances, you get moving again or do sauna so you can flush this stuff out of your system. You do the herbal therapy, you do everything that you can do, and you reduce that exposure as much as you possibly can. And that's how to overcome mold. Um, and now I'm not as sensitive as I used to be. I mean, it's been a long time, but for a long time, I mean, I could walk in a house and smell it, and it's like, oh yeah, I know exactly what's growing in this place.
Mhm.
I didn't need any kind of testing for me to know that there was mold around, and I would feel it pretty quickly. Less so now, but again, I was able to recover in that place, and I just made do with what I had.
What essential oil did you use for diffusing to get rid
My
of?
favorite was a combination called Four Thieves,
Okay.
which is really nice. It's clove and some other
Yes.
kinds of things. You don't want to pour it into the air you're breathing all the time because essential oils can be really toxic. That's a lot
Hmm.
of something that a lot of people don't realize. Essential oils and herbs are not the same thing.
Okay.
They have similar properties, but they're not the same. So what an herb is the chemicals, it's an extraction of the chemicals that the plant is circulating around within the plant and around the cells to protect cells from microbes, free radicals, toxic stress, and also regulatory chemicals that the plant is using to regulate cellular functions within the plant. What an essential oil is an insecticide, basically. So an essential oil is placed inside a vacuole, which is like a little bubble inside, in the inside stems and leaves. And these little bubbles are spread through the stems and leaves, but they're walled off. They're protected from the cells because they're a lot more toxic than the chemicals associated with herbs. So they're much more toxic to cells. And the whole purpose is when an insect comes along and starts munching on that plant, it releases these noxious chemicals and it drives the insect away. So that's what essential oils are, that's what the plant is using them for. Now, we're a lot bigger than an insect, so when we take them under certain circumstances, then they have anti-inflammatory and antibacterial properties too, so they can be valuable. But many of our essential oils, like clove as a pure essential oil, and a number of others, are really toxic. Um, Oregano oil that a lot of people use for Lyme, I did, is moderate toxicity. Neem and tea tree oil are on the less toxic end, frankincense. So those are some nicer oils. But even so, there's some people, most people that work with essential oils will tell you they are not to be used internally because they're so toxic to the GI tract. I think you can get away from them. I use some different essential oil protocols. I mean, I was trying everything, and I used neem as you get them in little gel caps. I actually did some protocols with some stronger herbs or oils like clove that I'd get a capsule and put a drop of clove and cassia and some of the stronger oils in it, and I took that, but all I could do was like 5 days, and it would start bothering my GI tract. So even like you hear a lot about essential of oregano oil. Oregano herb is different from oregano oil. So oil is the pure essential oil, And you really have to be careful because it can irritate your gut a lot. I generally do not start with essential oils in protocols. They're kind of the big guns if nothing else is working.
Okay. All right, we have a few more questions. Do herbs kill good but gut bacteria, and can they increase liver enzyme? How long can patients take them?
Yeah. Um, well, from my experience, you can take them for 20 years and experience the best health of your life. I don't take the quantities of herbs that I once did, but I take herbs twice a day, every day, and I have been doing it for probably close to 20 years now. And again, I've experienced some of the best health. It's been the best anti-aging program that I could recommend.
Okay.
Truly, it gave me my life back, which is pretty extraordinary. Um, Run that question one more time, Judy, so I get
Uh,
everything.
can they increase the liver enzyme?
And
And do the herbs kill good gut bacteria?
yeah, again, one of the things that I started out, and I assumed that if the herbs were actually killing the bacteria, the Lyme bacteria, they were going to wreck my gut like antibiotics. And my gut actually got better, and I've had the best gut health in the past 20 years that I've ever experienced. So I recognized that this phenomenon, the herbs, and here we're talking about virtually all herbs. Now, essential oils, they can mess up your gut bacteria, but most of the herbs will not. They actually suppress pathogens in the gut, like C. diff, like Canada, but they don't disrupt your normal flora. Again, it's a system. It's a defense system with intelligence, not like a single chemical like an antibiotic. So it's not just this random killer, it's a targeted solution. And so the plant doesn't want to kill its friendly flora, it's killing pathogens. And I actually found a study when I was writing my last book that documented this effect. It was really interesting that researchers had taken the time to actually prove this phenomenon with a number of different herbs. So the herbs suppress pathogens, they don't disrupt normal flora. You can take them for a long time. As far as liver function, what we know is that most herbs actually have a favorable effect on liver function. In fact, many herbs like andrographis, and the big one that most people hear about is milk thistle, actually have the ability to stimulate regeneration of liver cells. So the vast majority of herbs are liver protective. Now, here's what you hear from time to time, and I think this is really important. A lot of medical experts love to condemn herbal therapy. And it's like when I was writing my last book, I was looking for peer-reviewed studies to document herbal safety, thinking I was going to find some really great studies. And I happened upon a couple of studies done by medical experts condemning herbs as extremely harmful and dangerous. And then I looked on their list of herbs that they had chosen, and it was like a handful of herbs way down from that end of the list that of plants that I would define as poisons that nobody really, herbalists don't use. And they were using it to try to make this case that herbs were harmful. And I hear this, we see this from time to time. Here's the problem. Here's the problem, and this is really important for everybody that's listening to pay attention to. We as humans are exposed to more toxic chemicals than humans ever before on this earth, and they're all petroleum derived. 99% of drugs, the chemicals that they're made from, come from petroleum. Herbicides, pesticides come from petroleum. The heavy metals that everybody's talking about, the mercury and cadmium, come from coal. When we burn coal, it releases heavy metals that have been embedded in the coal out into the atmosphere, precipitates onto the ground, and it concentrates up the food chain. That's why it's found in heavy and in tuna and swordfish out in the ocean because it's concentrated all the way from the streams where these chemicals land all the way out. So we're bombarded with toxic chemicals, and our liver, our primary detoxification organ, takes a really bad beating. So, interestingly, for 20 years of my life, I did laparoscopies, surgeries the belly button surgery where you look inside people's abdomen. And every time I did one, I looked at the liver. And just almost across the board, if you look at somebody in their 20s, they had a nice, beefy, red, healthy looking liver. By 50, by 40, people were starting to get a mottled yellow liver. So we're exposed to so many environmental toxins, automobile fumes. Go walk by a highway in the wintertime, and it is hard to breathe because those toxic chemicals get compressed down to the ground by temperature inversions. So we're breathing a lot of more chemicals than we've ever been exposed to. We're getting them in our food. Most things that you get in the pharmacy that you rub on your skin, look on there. They have mineral oil in them. What is mineral oil? It's petroleum distillates. Most all of the skincare products are made from petroleum. They're toxic chemicals that don't belong in our body. They damage our cells. But they especially damage liver cells. So all of us are replacing our liver cells with fat cells. 25% of the American population is defined as having fatty liver. And another thing that happens is you kill your fat cells, you kill your ability to detoxify. But what's also interesting is these dormant microbes. We're finding that the liver actually has a microbiome of things that have ended up in our liver cells. So you stress those cells, and those microbes start to activate, and that compounds a problem. You can look these things up on an AI. Talk to your ChatGPT and start have a long conversation. You'll start confirming some of these things. It knows it. It's common knowledge. All these studies are very available. So people are developing fatty liver, and their ability to toxify toxins is low, and their liver cells are really, really stressed. So sometimes even an herbal therapy can be enough to cause toxicity. And because the only way to diagnose fatty liver is actually doing a liver biopsy, most people don't know how bad their liver actually is. So one thing that we recommend with everybody taking herbs is have your liver checked once a year. I always have mine checked. My liver function are really good. But there's another indicator too. Everybody's cholesterol goes up with rage, right? Why is that? You ask a doctor, they don't know. I did the research. It's because we're killing our liver cells, and our liver cells are what manage cholesterol. So as we're killing off our liver cells, we lose the ability to manage cholesterol, and our cholesterol levels go up. So if your cholesterol has been going up, it's because you're killing your liver. And if you take herbal therapy on top of that, sometimes it can tip the balance and cause stress. But that's very, very unusual. But that's what's happening in cases where you hear that people have elevated liver function. Now, what I generally tell people do is just back off on the herbs for a while and take some herbs that we know really enhance liver function, like milk thistle, and with time it actually gets better. So another thing that we see too with this is that as I said, you have microbes, your liver cells are stressed, you have reactivation of microbes. So another thing that these antimicrobial herbs are doing is clearing cells that have been compromised by microbes, and that can include liver cells. So when you go to the doctor and get your liver enzymes checked, what is that? Well, liver cells, enzymes are what make our cells work. Enzymes are the machine that whatever job that cell has, the enzymes are the thing that is doing the job inside. So when you rupture the liver cell, it releases those enzymes into your bloodstream. Well, we're all the time losing cells. So everybody, if you measure somebody's liver enzymes, we all have some liver enzymes in our blood. But if you have high levels, it means that the rate of liver damage is accelerated. So sometimes we have a situation where the herbs are actually clearing damaged liver cells to make room to regenerate new liver cells. And it looks like liver damage, but it's actually the opposite. It's the liver healing itself. So these are the kinds of questions that most doctors don't ask. They don't understand these things, but it's really important to look at the science, and really get to the bottom of these kinds of questions.
Okay. How about will the herbs interfere with cardiac meds?
The biggest way that they could do that is if someone is on blood thinners. And most of our herbs have a slight blood thinning properties, and also your omega-3s like fish oils and things like that will have slight blood thinning properties. That's the biggest way that they can do that. But most of the herbs that we define as adaptogens don't have drug-like properties, and they don't really interact with drugs in a significant way. That is the only way. In fact, most of them, like Japanese knotweed, contains resveratrol, which really is very beneficial for heart health. So we really have some very beneficial properties. I rate herbs. So if you're interested in knowing more about herbs, my last book, The Cellular Wellness Solution, is basically has an herbal manual inside of it. And I rated herbs as green, yellow, or red zone. So those herbs down at the other end that have those drug-like properties that would even be poisonous, I put those in the red zone. Some herbalists have used them historically, but they're not used very often. Again, that's where our drugs come from. 50% of drugs come from plants. Those are the plants they come from. The next zone is yellow zone herbs, the herbs that have some drug-like properties that can interfere with medications. And the biggest one would be St. John's wort that you hear about. Actually, it works very much like Prozac. I don't really use those yellow zone herbs very much at all. I like the green zone herbs because what they're doing is suppressing microbes, restoring cellular health, and they're enhancing our health at the cellular level. They don't have, the potential for reactions and drug-like effects is really, really low. So I like to stay in that range. And so it's really different where a lot of herbalists are using what I would define as yellow zone herbs because they're trying to get an effect something like a drug.
Okay. If you're okay, I have just a couple more questions.
Sure,
We'll try to wrap it up. I don't want to take all of your evening.
I'm fine.
Can Lyme disease damage the kidneys? Someone's kidney function's been declining since they got Lyme disease.
Can Lyme disease? Yeah, it does. Various kinds of microbes do, and this is not recognized very often, but they do. They can invade kidney cells, and there are various kinds of microbes that do. So we know that's an effect. But the other detoxification organ is your kidneys, and not only is our liver getting pounded, but our kidneys are getting pounded too. So we're filtering a lot of toxic substances, but we're also eating bad food. When you eat, the typical American diet is really heavy in grains and meat. And a lot of people are eating about half grains and about half meat. So they're getting a lot of processed carbohydrates and they're getting a lot of protein, more protein than they really need. So when you break down protein to amino acids and you can only use so much of the protein that you eat. Most of it is actually turned into fat. And to turn it into fat, you have to break off one of the little connecting pieces of the amino acid that makes it the amino part. You have to break off, and that thing is called ammonia. And your kidneys have to filter that out. So ammonia is turned into urea, but it's pretty toxic stuff. So if you're on a high protein diet, if you're eating a lot of meat, and especially if you're eating high carbs on top of that, you're really doing a bad job, bad thing to your kidneys. So it tends to be more of that than anything else. Now, as far as the herbs, several of the herbs, with cordyceps is the one that's been most studied, actually has some really nice protective effects on kidney functions, kidney cells, basically.
Okay. You said that herbs are central to getting better, but are not everything. And could you please talk just a little bit about what else, in addition to the herbs, is included in the Restore 180
Yeah.
program that helps with getting better?
Yeah. It is, we realized over the years that recovery is a process, and people come in the door that their whole body's in turmoil. They're past their boiling point. Microbes are basically breaking their body down to create a food source to grow more microbes. And all those stress cells are sending distress signals to the brain, which activates that fight or flight response. So everybody thinks that gut dysfunction is related to bad food. That's a factor. But the biggest thing that I've seen them for most people is it's it's that overactive fight or flight. So when you activate your sympathetic nervous system and you suppress your vagal system, your basic maintenance type system, you stop gut function. And that causes everything to back up and bacteria to overgrow, and it wrecks the gut. So high sympathetic tone, overactivated fight or flight wrecks the gut, blocks detoxification, and it keeps people from sleeping. So that's the first problem to address. And you can use herbs to help with that, calming herbs and adaptogens that balance our stress hormones. But it's also a process of learning how to short circuit that stress response so that you can calm your body despite the turmoil inside. And that opens the way to restore gut function, to open detoxification pathways, and ultimately to really work to restore cellular health in your body. So, what good health is healthy cells and calm microbes, dormant microbes. You're not going to eradicate these things. They become ill-fitting residents in your body, but you can keep them suppressed, and that's what it's all about. So, just winding that up, a formula for health to think about. This is what wellness is. So, your whole body is made of cells. Everything in your body is made of cells, and it's held together by connective tissue. Everything that happens in your body, whether it's your heart beating, a thyroid hormone being produced, your brain cells, your brain functions, it's all done by cells. Absolutely everything is done by cells. So we divide the body up into organs, but an organ isn't the smallest functional unit. A heart is not a single unit. A heart is a composite of billions of heart cells working in synergy to pump blood. The same with your brain, so the same with every part of your body. So the smallest functional unit is a living cell. And every cell in your body, even though they're all connected, they're all communicating with hormones and signaling agents and nerves. That's what cellular communication is all about, is coordinating so your body functions as a whole. But every cell is independent. Every cell in your body comes from one cell originally. So they're all structurally similar, and they all, if you look at them and think about your cells as little microscopic machines, they have specific operating requirements. They're mechanical. So every cell in the body needs five things. Every cell. And if it's not getting these things, the cells become stressed. And what chronic illness is sick cells. When your cells are sick, your whole body's sick. When your cells are well, when your cells are collectively well, you won't have symptoms. Symptoms are a reflection of stress cells in your body. So, five things. Cells need the right nutrients. You're eating a whole food diet, you're getting a whole cell diet, and you're getting a broad spectrum of nutrients that are going to give your cells all the different things that they need to function. They run lean, they don't need much carbohydrate and fat. Our ancestral diets were very lean and low in calories. We ate way too many calories, we ate way too much carbohydrate and fat. We also eat way too much protein. You don't need much. So, you got to have the right nutrients. Cells have to be a clean environment. All these petrochemicals and mycotoxins and everything, what they do is they get in your system and they damage your cells. They gum up cellular function so your cells don't work right. And if your cells don't work right, you get symptoms and you feel bad. Number three, cells need downtime. Cells need to recover. They work all day long. They work hard. They're generating wear and tear. Every machine generates wear and tear. They have to constantly repair that, but they need downtime. Now, some cells, like our heart cells, have to rest in between beats, and that's why our heart cells are so vulnerable. But most of our cells need 8 hours of good sleep every night to recover and regenerate, especially our brain cells. Every cell, they have to clear out toxins, they have to rebuild, and they have to have time to do that. So if you're getting 6.5 hours of sleep, which is average for Americans, you're starting every day, your next day, with a deficit that your cells haven't recovered from the day before. If you're fatigued and you're only sleeping 6 hours a night, it's because your cells aren't recovered. That's the problem, not because you're not getting enough caffeine or any other nutrient. Your cells aren't recovered. So that's number three. Number four, cells need good blood flow. Ancestrally, we are busy people. We've been walking the earth for thousands of years. And our cells need good blood flow. So we get a lot of things out of exercise, but the big thing exercise does is it moves blood and it moves lymph. And that flushes our cells and carries away waste. And it's essential. The first step in detoxification is flushing congestion and built up toxins from around those spaces around our cells. You have to move to do that. And if you can't move, like I didn't, then infrared sauna or any kind of sauna can sub in for that. And the last thing is we all pick up microbes. Microbes are our cell's arch enemy, and they need extra protection, not just the immune system. And for thousands upon thousands of years, humans have been eating herbs, and we get that extra defense that we need that we're not getting from our drugs and our food or anything else that we're doing now. And that's wellness in a nutshell. You do those five things. That's you have to do those five things to get well. And what healing is the ability of cells to regenerate and recover. If your cells are stressed, they can't regenerate and recover. You can't heal. So in the beginning, I said drugs don't heal, but herbs do. All right. Drugs block chemical processes, block enzymes to keep us from having symptoms or slow down these abnormal processes, but they do absolutely nothing to reverse any of those cellular stresses except for antibiotics or vaccines in acute infections, but not this chronic stuff that we're talking about. So our drugs are not affecting cellular stress. Herbs are affecting cellular stress, so they're actually promoting healing at the cellular level. So that's a good thought to leave you with.
Um, Someone's asked, can you give us an approximate cost of your program?
It's 250 for the first month, and then it's up about $299 a month. So that's a complete herbal protocol, and it's graduated. In the beginning, we used to give people the really strong herbs right in the beginning, and we found that when their body is in total turmoil and their liver is stressed and their GI is stressed, it's really they don't tolerate it well. So we start out with herbs that are calmer, that are less intense, and we gradually bring people through an entire process. This is something we've been working on for years. It's within a community that we basically have our own private social media network. We have a phone app, and within the network, there are lessons that people do, short videos that I've done. There's a resource library that's built to answer virtually any question. And there's a constant feed that you can talk to other people at your same level that are going through these same issues, but also talk to mentors and moderators that are beyond your stage. We also have health coaches that have been working with me for a decade that integrated into the program are periodic group sessions with the health coaches, but also individual calls at each stage in the program. So there's an enormous amount of support just to bring everybody along at every step of the game, and then graduate these supplements in a way that people can tolerate them. And yes, we make accommodations for a lot of people that can't tolerate this herb or that herb. If we don't have something, then we will recommend a source that they go and get it. But that's the kind of support you get. You will never find that kind of support in any doctor's office, period. You won't get it. And the app on your phone, I mean, it's like instant answers. You can get what you need most anytime. And it's so we put an enormous amount of work into this program. We're just getting started, and it's a passion of mine that I've been working on for years because I know what it takes for someone to actually get well. And it's not procedures, it's not big expensive therapies. It's it's restoring your health at the cellular level and containing this microbe threat in a way that isn't distressing your cells.
Okay, thank you for that.
Sure.
Two more really quick questions.
Okay.
Name an herb that can kill staph, and what's the best herb for sleep? Insomnia.
There are a lot of herbs that kill staph. I mean, there are many of your herbs that we don't even consider very good antimicrobials will kill staph, and also MRSA too. So, the herbs do a pretty good job killing staph, strep, those kinds of things also, because many of those, you know, in, they're opportunists. I mean, everybody has staph on their skin. Everybody has strep. We have a lot of these microbes that we carry all the time, and they don't cause you problems unless they find an opportunity. Your body, your cells have to be stressed, and that's when they can pop up. They become more of a problem, though, when they become antibiotic resistant bacteria, and that makes them more aggressive. And when you look at this enormous problem that kills 1 million people every year of antibiotic resistant pathogens worldwide, herbal therapy may be our best hope because this is going to get worse and worse and worse. Again, they haven't made new antibiotics since 1985. And and every year, the census of people dying gets greater and greater. So herbs may actually be our best hope against staph, methicillin resistant staph, against C. diff, against Candida, all of these things that you hear about that aren't generally pathogens unless they get an opportunity.
Okay. And insomnia?
Insomnia, what everybody wants. what I wanted. I mean, what wrecked me was I lost the ability to sleep, and it was horrible. And boy, I wanted what everybody wants. What everybody wants is the herb that you can take when you're really agitated and is going to give you a perfect night's sleep and has no side effects and no potential for habituation. That's what everybody wants. And it doesn't exist. I can tell you
Mm.
right now. The only thing that will actually do that is a drug. Ambien, Lunesta, there are lots of them. I tried them all. Became habituated to them. And what I can tell you is being habituated to benzodiazepines or sleeping pills is a much worse nightmare than Lyme disease than you can ever imagine. It's horrible. It took me several years to get off of them. And I was a doctor that rarely used those drugs, but I was really desperate, and that's what they gave me. That's all they had to offer. And they work in the beginning like a charm, but then they stop working and your insomnia is much worse. So the herbs don't do that. They aren't that strong. So what herbs do is have mild calming properties, and they are affecting your neurotransmitters in a way to balance them. But you're just not, if Ambien and the sleeping pills are a hammer, then all of your herbs are a fly swatter. Um, but the more potent the herb, like some of your better herbs for sleep, like kava, like valerian, then you're starting to have an herb that has habituating properties that can lead to end up, as that stops, then you end up needing something stronger, and you eventually go to the drug. So milder herbs like passion flower that we use, lemon balm, bacopa is a favorite. They're mild sedatives. We use some calming herbs. So one of the things we use is a product that has ashwagandha, which has the effect of calming stress hormones. I combine it with L-theanine, which is an herbal phytochemical that calms your activating or stimulating neurotransmitters, and then several calming herbs, a philodendron and a magnolia species. And it doesn't have the habituating potential or some of the problems of the drugs. But even then, we don't like to use that long term. We use that in the first two phases, and we generally wean people off of it. Most people benefit from it in the beginning. But like any herb, it has cell-protective properties, adaptogenic properties, some antimicrobial properties. Ashwagandha has some antimicrobial properties. All herbs do.
Mhm.
Um, but we also, sometimes use passion flower, bacopa, lemon balm, some of those milder herbs too. But none of them are going to be the sledgehammer that people are really looking for. They're just a mild adjunct. You still have to learn relaxation techniques. You still have to do some brain retraining. You have to short circuit that stress response even while your body is still in turmoil so that you can get some sleep, so your gut will start working again. So we generally work on that for about 2 months before we really even start the diet and detoxification phases.
Okay. Well, this has been very enlightening, very
Mm,
good. We've had some people that had to jump off and they are saying thank you, as we all
pleasure.
thank you. Thanks for those who came back on. Some way I hid myself and I can't find out how to get it back, but I'm Judy for those of you who don't
Uh,
know who's talking. So,
oh, I can
um,
see you, Judy. Your
oh, you
picture's up
can?
there. Yeah.
Okay. Okay, good. Thank you so
All
much
right.
for
Well, yeah, give me feedback. Tell me what